Hello, I'm Dr. Averett, the Medical Director of Adult and Family Medicine at Legacy Community Health. I'm going to talk today about why it's important to get vaccinated against COVID-19, what is the Delta variant, and other questions people want answered about the vaccine. As of July 14th, 2021, just under 50% of people in the US are fully vaccinated. With that many people vaccinated, how important is it for additional people to get the COVID-19 vaccine? I want to make it very clear, COVID-19 is still very much a threat to the people who are unvaccinated. COVID-19 has caused very serious illness and death for a lot of people. Some people who get COVID-19 can become severely ill, which could result in hospitalization, and some people have ongoing health problems several weeks or even longer after getting COVID-19. We want to achieve herd immunity, which is when a large enough portion of a community is immune to a virus so that the virus can no longer spread easily from person to person. It's still unclear exactly how many people must be vaccinated in order to achieve this herd immunity, but experts estimate that it will take around 70 to 90% of the population. What is really important to remember, though, is that some people cannot get vaccinated due to their age or underlying medical conditions. So those of us who can get vaccinated need to do so to protect those who cannot. Plus, if you get COVID-19, you also risk giving it to a loved one who may get very, very sick. And once you're vaccinated, you can resume activities you did before the pandemic, that quote unquote getting back to normal. True or false? If you had COVID-19, then you don't need to be vaccinated since you're already protected. This is also false. You should get vaccinated regardless of whether you already had COVID-19. Studies have shown that vaccination provides a strong boost in protection in people who have already recovered from COVID-19. We don't quite know yet how long you are protected from COVID-19 after getting sick and recovering. Even if you have already recovered from COVID-19, it is possible, although rare, that you could be infected with the virus that causes the disease, especially as new variants continue to emerge. Should people with chronic health conditions and underlying medical conditions get the COVID-19 vaccine? Short answer, absolutely yes. Adults of any age with certain underlying medical conditions are at increased risk for severe illness due to COVID-19. The vaccines are extra recommended for these populations. The list of high-risk medical conditions that put people at increased risk for severe COVID-19 associated illness is updated routinely as new data become available. It includes chronic lung disease, asthma, cancer, diabetes, heart conditions, HIV, obesity, pregnancy, and smokers. It also includes older adults ages 65 and up. Should children get the COVID vaccine? This is another absolutely yes. The Centers for Disease Control recommends everybody ages 12 years and older should get the COVID-19 vaccine. As we've already discussed, it has been studied and proven to be safe and effective in ages 12 to 17 in the US using the Pfizer vaccine and 18 and over using the Moderna vaccine. What is the Delta variant and should we be concerned? We know that the Delta variant is more contagious than other virus strains. It spreads more easily between people, and it appears to spread sooner than the original strain. People who are infected with the Delta variant also may get sicker. Recently published research from Scotland has shown that unvaccinated people who are infected with COVID-19 Delta variant are twice as likely to be hospitalized than people infected with the original COVID-19 variant. The COVID-19 vaccines offer the best protection against the Delta variant. The current research suggests that COVID-19 vaccines that are available in the US, the Pfizer and Moderna and Johnson & Johnson, adequately protect against the COVID-19 Delta variant. The CDC, and Legacy recommend that people who are not vaccinated against COVID-19 get their vaccines to protect themselves from the risk of illness from COVID-19, including the Delta variant. For those who aren't vaccinated yet, including those who may not be eligible at this time to get vaccinated, It's important to keep in mind we continue to practice those risk mitigating behaviors to help prevent illness, such as wearing a mask over your nose and mouth while around other people from other households, staying 6 feet away from people who aren't part of your household, washing your hands frequently during the day with soap and water, and avoiding crowded indoor spaces. What does the COVID-19 vaccine cost, and where can people receive the vaccine? The COVID-19 vaccine is free. And remember that if you get the COVID-19, there are likely to be costs associated with your illness too, not to mention missed time at work, potentially long-term health conditions, among other reasons to continue to get vaccinated. The COVID-19 vaccine is available at many locations, from community health centers like Legacy Community Health to retail pharmacies and grocery stores to other community organizations. The CDC website and many communities have listings for nearby sites. If people have additional questions about COVID-19 vaccine, who should they talk to? If you have additional questions about the COVID-19 vaccine, I recommend you start by discussing them with your primary healthcare provider. If you don't have a primary healthcare provider, you can search for local healthcare providers who are offering the COVID-19 vaccine and may be able to address your concerns. You can also find the latest information on COVID-19 and the COVID-19 vaccines at www.cdc.gov.